What we'd like to do today is to take some T-scan force measurements on Kendall, and as we're taking those measurements, we're going to be getting used to using the T-scan equipment. One of the critical features of taking good force scans of patients' forces in between their teeth is to make sure that their posture is normal when you're taking the scan. Some people ask a lot of questions about whether we should take the scan standing up, sitting down on a chair, or in a dental chair. And I prefer to take my scans in the dental chair, which is our normal working environment. So in order to make sure that the patient's bite relationship is going to replicate their normal alert feeding position, we need to keep their posture relatively normal as we get them situated in the chair. If you would like to test this for yourself to see why we do this, one of the things that you could do is just have your patient tip their head all the way back and look up at the ceiling and tap their teeth together. And now tip your head all the way forward and look down at the floor and tap your teeth together. Do you feel like the same teeth touch when you tip your head forward or tip your head back?
Different.
Definitely different. Yeah. And you'll find this is true for you as well. So that's why it's important for us to recreate her normal posture when we place her in the dental chair. So Kendall, if you'll just stand straight for me in your normal posture, look right straight out toward the horizon for me, and I'm just going to take a look, lining up your ears, your shoulders, your hips, and what your normal angulation of your neck is as I'm going to be positioning you. So I'll make a mental note of that, and I'll ask you to tap your teeth together so you can see what it feels like when you're in your normal posture.
Okay.
All right? All right, so now we have Kendall in the dental chair, and most of our modern dental chairs have great headrest adjustments on here. So we'll have our patient rest their head on the headrest, and you notice that if I tilt her head back, that this will put her into an abnormal neck posture. And I could have Kendall tap her teeth together and say, does that feel the same as when you were standing upright?
No.
No. So I'm going to support your head. I want you to keep your head on the headrest, and let's support your head back to its normal head posture, which is probably about right there. I'm going to take a look at her ear, shoulder angulation, and then I'm going to ask her, does that feel more like your normal
Yes.
tooth coming together? So I want you to keep your head stable in this position, even if we change the position of the chair.
Okay.
Okay, thank you. Now we're going to have Kendall lean back. And I do most of my T-scan measurements and adjustments at approximately this angulation, which I would say is approximately at 60 degrees up. So in this position, I'm going to once again take a look at her ear, shoulder, neck posture. That looks pretty normal to me. I'm going to have her tap her teeth together again. Does that still feel like you're in the same range?
Yes.
Okay, very good. Now this is the position from which we'll be taking our T-scans today.